President Buhari prays for Nigeria's continued peaceful coexistence at Lesser Hajj.
Nigeria expresses commitment to its obligations to ECOWAS and the African Union.
And Senate canvasses improved funding for the NTA to be a leading broadcast outfit.
We need revenue for the NTA to stand and compete favorably with other media establishments.
On Good Morning Nigeria today, we shall focus on breast and cervical cancer management. What works?
All right, so breast and cervical cancer, what works? Let's begin with some statistics from the World Health Organization. Every single day in Nigeria, 15 men die of prostate cancer. Now that aside, 31 women die of breast cancer, while 28 women die of cervical cancer.
That's quite an alarming claim, and to think that in Nigeria, cervical cancer, which is preventable with the human papillomavirus vaccine, is still killing women every single day, and that's sad.
Really sad, Kingsley. You may also wish to know that a country like Rwanda, for instance, is said to have the highest rate of cervical cancer in the world. But the good news for them is that that country has achieved almost 100%, I mean less than 2, coverage in the human papillomavirus vaccine target.
Now, cervical and breast cancers have better prognosis and treatment if diagnosed early. But studies done in Nigeria suggest that a large number of women present their cases at the last stage of the diseases.
And talking about prevention, experts are warning women to be mindful of the factors that can trigger such cancers, including lifestyle exposure to certain chemicals and radiations, as well as some viruses, and not, of course, to forget that there are hereditary factors.
Efforts have been made by the media and non-governmental organizations and some state governors, the wives of state governors, that is, under the auspices of the First Ladies, against breast and cervical cancer, to use the month of October, which is regarded as Breast Cancer Awareness Month, to continue to educate women, especially in the rural areas, on the hazards of breast and cervical cancer.
Indeed, the question is, despite the awareness created, why do we still have a significant number of Nigerian women, still dying from breast and cervical cancer? When will the girl child start receiving the human papillomavirus vaccine that prevents cervical cancer? And how often is screening provided for breast and cervical cancer? And also how accessible are cancer medications and treatment? These are some of the questions we'll be raising for our panel of discussants on today's edition of the program. Again, our focus is on breast and cervical cancer management, what works, and we will also be sharing very, very useful perspectives from survivors. So it's Friday, and we welcome you to Good Morning Nigeria. It's live on the network service of the Nigerian Television Authority, the NTA. I am Claire Delabu Abdulrazak.
And I'm Kingsley Osadolo. I join my colleague Claire to also welcome you to the program from our headquarters studios in the nation's capital. In the course of the program, we have our regular complimentary segments, and these include Mr. Caribbean Business.
All right, it's still Good Morning Nigeria on the network service. A bit of business news now. And the ongoing 2021 Nigerian FinTech Week, key players believe the industry remains the central hub, attracting significant investments into the country. So what more do we want to know? We have details with Alika Ogbanachi Arua.
This was part of the critical issues discussed at the Day 3 session of the conference, which featured a panel discussion on sustainable investment for scale. Key drivers of financial technology says fintech is at the heart of the economy and can be embedded into every critical sector of the economy, such as digital financial services that can help drive financial inclusion efforts in the country. Meanwhile, oil prices slumped to the lowest in 2 weeks on Thursday, after Iran said talks with world powers on its nuclear program will resume by the end of November, and U.S. crude inventories rose by much more than expected. Brent crude oil was 69 cents, or 0.8%, lower at $83.89 a barrel, having hit a 2-week low of $82.32 earlier and falling by 2.1% in the previous session. U.S. West Texas Intermediate crude was down 53 cents, or 0.6%, at $82.13, having earlier touched a 2-week low of $80.58 and dropped 2.4% on Wednesday. With business news, Alika Opanachi, Arua.
Thank you very much, Alika, for the business news package. Up next is newspaper review.
All right, let's welcome Bayo Atoyebe, who's already here with us. Bayo, good to see you this Friday.
Thank you, Claire. Good morning. Good morning, Kinsley.
Good morning, Nigeria. Good to see you. Yes. Okay. We have two newspapers, Leadership on Friday and The Punch. Let me begin with the Leadership newspaper. Crisis rocks Plateau Assembly and 2 speakers emerge. New 14-bed presidential clinic to cost 21 billion naira. And there is a kicker to the headline for the lead story, rot in education sector. ASU moves against overseas education for children of the elite. ASU moves against overseas education for children of the elite, blames them for falling education and insecurity, and initiates Bring Back Your Children bill. Nigeria facing major education crisis. You can see the photograph there on the front page showing the President, Muhammadu Buhari, and the Minister of Communications and Digital Economy, Ali Patamin, along with Saudi officials in Makkah for the Lesser Hajj, and that was yesterday. ICPC recovers 241 houses from one civil servant, 60 houses from another, so that's 301 houses from 2 public servants. FBN Holdings appoints Okonkwo as GMD, AK retires. Federal government to media, be Nigeria's watchdog, not lapdog. Facebook rebrands, changes name to Meta. Troops kill 38 terrorists and 1,199 others surrender in Borno. Claire.
Very interesting developments, Kingsley. Okay, the Punch newspaper is leading with the PDP convention, and it captured its headline this way: Secondus suits ruling. Uncertainty reigns as 3,600 delegates arrive Abuja for PDP convention. Details of that on page 2. And there are, riders there. And again, this picture story, Kingsley already read out the situation in Plateau. And you see the picture stories there. That's with the impeachment of the speaker. And other stories trading at the bottom of the paper. NIMSI suffers network delay amid race to meet SIM-NIN deadline. And 189 bandits, terrorists killed. 1,199 surrendered in 2 weeks. That's DHQ. And other stories. Let me quickly take you above the nameplate. Let's see what's trending here. Okay, 21 billion naira, 14-bed Asu Rock Clinics construction begins in November. And government workers' future shaky as 20 states shun contributory pension scheme. 5 states insist on other pension schemes. 7 still at bill stage. Details of that on page 2. Nigeria tops chart as 11 African countries block airlines $700 million revenue. And I think the other stories, Kingsley had already taken. Bio.
Thank you, Claire. Well, let's start with the development in the Plateau State House of Assembly. Some members of the Assembly elected Honorable Yakubu Sanda as Speaker. The majority leader, Nadong Daniel, says that the new Speaker emerged after 16 of the 24 members signed a petition to impeach Nuhu Ayuba Abok. However, Daily Trust reports that the issue of impeachment created tension among the 24 members of the state. The PDP members, loyal to the Speaker, took the mace to prevent the impeachment, which required 2/3 of 24 members. The APC members, who are in the majority, dragged the mace in place and went ahead to impeach the Speaker, Nuhu Ayuba Abok. There were allegations of misappropriation of funds and how Abok lacked capacity to lead the House. 3 times it was said that he refused to receive the 2022 appropriation bill from the state governor. But some members also claim that only 8 members actually gathered to impeach the Speaker. Therefore, they accordingly gathered also at Zawan Community Hall in Bukuru and also suspended 7 members of the State House of Assembly. So we don't know how they will resolve that. Apparently, the Speaker has been impeached, according to them. The others say that no, the Speaker has not been impeached, rather members that have been suspended. There's a story that Kingsley read about it. The independent corrupt practices and other offenses related have seized 241 houses from one individual and 60 others from another, all in the Federal Capital Territory. The report indicates that this was discovered from investigations of the ownership of many uncompleted luxury estates dotted all over Abuja. The other story is Academic Staff Union of Nigeria University says they are going to step up and stop children of the elite being sent abroad to study. The ASU president indicated so at the State of the Nation Summit they held in Bauchi, and he says that they propose to sponsor a bill to bring back your children. That will be the title of the bill. And they say they are going to mobilize the non-governmental organizations, student unions, and the academics to press for the passage of that bill. Meanwhile, the inspector...
How feasible is that?
Well, it's a bill
eh?
that will go at the citizens' bill, go to the House, and let's see how it goes through the legislative process. There are 3 ways you propose the bill. Members' bill, executive bill, and a citizens' bill that can go through a member to the floor of the House.
I know it's they want to take it in the form of a bill, but the feasibility of that bill going through, it's what I'm asking, because it touches on fundamental question of human rights.
Well, that's true, but according to the ASU president at the one-day State of the Nation Summit in Bauchi, he was blaming the nation's leaders for security challenges facing the country, and also said that the elite, had wrecked the education system through their negligence and other negative practices, and they are, quote, shamelessly sending their awards to countries where the political elite did the needful to maintain and improve their own education system. So I understand. I mean, it's part of the agony that ASU and other key stakeholders have often gone through, and whatever measures they think are feasible in the circumstance to stop the neglect of the education system in the country, they will try to pursue. El-Rufai at some point took the step of sending his child or children, I'm not sure how many of them that he sent, to public schools. But you see, the typical problem that the Nigerian elite presents is when we have issues at home, everybody seeks escape. That's to say, look, what are you doing here? So go out. It's the same thing with medical care. If anything that happens, no, send your child out. So where you are sending your child to, or you are sending your ward to, how did they develop and have continued to maintain their system and standards? I think that's the point of ASU. I know that the issue of rights that you mentioned is there, but there are roundabout ways that you can get this. You have never, over the decades, it's not been possible to stop Nigerians from traveling abroad, in search of the golden fleece, and so on and so forth. But the hemorrhage that is occurring, people can do this, through forex restrictions and so on and so forth. But then, there will also be an uproar that you are trying to stop human capital development. So it's a catch-22 situation.
And this is where in a democracy, it's not as if we're in an authoritarian, regime where you can come down hard. It's a genuine cause.
Yes,
it is a genuine cause. There's no doubt about that.
There could be a balance too.
Yes.
Ability to go to the National Assembly to ensure that academic institutions are not closed on the basis of strike for a period as long as 1 year. Last year we lost an academic year. So
that is one. Bayo, good point. You raised this. Let's see if ASU itself will comply. The other point I mentioned earlier was to use monetary policy to say, look, there could be restrictions on forex remittances, for forex transfers for education.
For courses that are available in Nigeria.
For courses that are available in Nigeria, maybe at least for first degree or postgraduate courses, you would say, to maintain the idea of a university being universal, where you can send qualified students outside. The other point, Bayo, is what happened lately at Obafemi Awolowo University. I sometimes wonder why, when there is a crisis in an institution, almost always the first reaction is to say, close the school down. Which is what has happened in the case of Obafemi Awolowo University. There's a conflict between the students and the authorities. They say, look, shut down the school, send away the students from the house of residence. And, a university is a system. When you shut it down, by the time you are seeking to reopen, it takes a while. It takes a much longer time for things to get back. It's not just as easy as saying, look, okay, we close you down this Friday, come back on Monday, as if you were on a midterm break, and so on and so forth. I often ask myself, what is it that universities do in terms of crisis or conflict management within their own institutions?
Just about a month ago, University of Benin, you recall?
That's right.
There was this increase about if you don't pay your fees by a specific period, you pay extra 20. The student went out and demonstrated, and there was instruction to shut down the school. The student had to force the vice chancellor to a public rally to renounce that closure before things got sorted out. When you close institutions, a lot of things are affected. Not just only the student, even the parents are concerned. And the whole academic calendar and curriculum is grievously affected. And it undermines the quality.
That's probably the best ad hoc measure, available to them at the time to, prevent any breakdown of law and order. And like Kingsley said, it's not a short term, well, it's not as if you close the school and then, the following day you say students to come back. So there must be a kind of a conflict, management mechanism inbuilt.
Not the knee-jerk reaction of saying, oh, there's a curfew, shut down the schools. What we have seen some positive development, at least since 1986, when you had the ABU students' riots and officers of the mobile police force stormed the campus and there were a number of casualties. Since then, law enforcement agents don't get into campuses and the authorities don't invite them, and the students also behave themselves. So unless, of course, there's matters get out of hand, there must be ways of apprehending crisis before they snowball into some major thing that is uncontrollable. Claire, that's one. But I just want to, Bayo, you mentioned this story, the details. Let us read some of the details. What ICPC is saying, that 2 individuals, they have recovered 301 houses from them. ICPC chairman, he was speaking at the House of Representatives. He said that the commission revealed that public officers topped the list of fraudulent investors in the real estate sector in Abuja. adding that they are well involved in illicit financial flows in the country. He also drew attention to the fact that in Abuja, around the metropolis and central area, there were a lot of estates that are built up but empty. According to him, if they had been constructed with funds that were borrowed at market rates, I don't think any investor would allow such properties to be empty.
Bayo, we don't have time. Sorry, ICPC is on top of its game, so we'll leave that. Unfortunately, it has to do with civil service. Bayo, it's Friday. Please do have a wonderful weekend.
Thank you.
All right, so let's go at a short break. We'll be right back. All right, this promises to be an interesting conversation we will have today on Good Morning Nigeria. It's one that will be so emotional, but of course, there'll be so much more for you to take home. The topic for our conversation is breast and cervical cancer management. What works? And like I told you earlier on, we will be sharing very, very insightful perspectives. But just to begin our conversation, let's listen into our background report, and it's put together by our correspondent, Ekene Ndilwe.
The World Health Organization identifies cancer as the second leading cause of death around the world. It is responsible for 70% of deaths in low and middle income countries. This is more than the number of deaths from HIV/AIDS, malaria, and tuberculosis combined. In Nigeria, it is estimated that around 72,000 people die each year from cancer among the more than 100,000 cancer diagnoses. Among the various kinds of cancers, breast and cervical cancers are the most common causes of female cancer-related mortality in Nigeria. Statistics show that cervical and breast cancers have a better prognosis if diagnosed and treated early. Studies done in Nigeria suggest that a large number of women present their cases at the late stage of the disease. Some of the reasons that have been provided for this include low literacy levels, high rates of poverty, and low level of awareness of breast and cervical cancers. Risks attached to this late presentation is usually enormous, leading to huge cost of treatment and increased mortality. To prevent this disease, experts say women should be mindful of the factors that can trigger the ailment, like lifestyle, exposure to some chemicals and radiations, heredity, and some viruses. Early detection has consistently been advocated as the right treatment. What are the early signs of these diseases? How can policymakers help vulnerable women in the rural areas in the area of prevention and early detection? Guests on Good Morning Nigeria will be speaking to the issues in a moment.
Thank you very much, Ekene Ndule, for that background. With us in the studios now to discuss this subject matter. Let's welcome our regular guest. He's an expert on this subject. That's Dr. Abubakar Mohammed Bello, who is President, Africa Organization for Research and Training in Cancer, and also a Chief Consultant Clinical Oncologist at the National Hospital in Abuja. Dr. Bello, pleasure to have you again on Good Morning Nigeria.
Thank you for having me again. And good morning, Nigerians.
Also here with us in the studios is Ronsi Chidebe, Executive Director, Project Pink Blue. Ronsi, delighted to have you with us this morning.
Thank you very much.
Okay. And Chioma Ikejane, she's good news, stage 4 breast cancer survivor, and host and producer are more unplugged. Chioma, great to have you with us this morning.
Thanks for having me, and good morning, Nigerians.
Indeed, Kinsley, maybe we should add good news, Chioma Ikejane, to her name. But let me also quickly bring in our next participant on today's program, Emmanuel Okore. Emmanuel Okore is Chief Executive Officer, Emerge, I hope, Resources Limited. I hope I got that correct, Mr. Okore.
MG Resources, ma'am.
MG, thank you. Thank you. Also joining us via Zoom is from Akure, the capital of Ondo State, is Her Excellency Mrs. Betty Anyanwu Akeredolu. She is the founder, Breast Cancer Association of Nigeria, BRECAN. She is a 24 years breast cancer survivor. Another good news. And she's also wife of Ondo State Governor. Please join me to welcome Mama Digital from Akure. Thank you very much, Your Excellency, for joining us.
Thank you. Good morning, Nigeria.
All right. Once again, pleasure to have all our guests with us this morning. Let's begin with Dr. Bello. Dr. Bello, we've had you on several occasions discussing this subject matter. I was just wondering, are we making progress, for instance, with regard to breast cancer treatment and cervical cancer management?
Thank you so much, Kinsley. Yes, we are making a lot of progress in terms of treatment worldwide. Gone are the days where you just go and remove someone's breast, for example, because these days you can even do breast conservation surgery. Gone are the days where you give drugs across board for breast cancer, because now you do individualized treatments. In other words, it's tailored toward the particular type of breast cancer. So we have recognized fundamentally 4 subtypes of breast cancer now, based on the type of receptors that we can actually detect on the patient. In other words, there are certain receptors that are found on different breast cancers. Now, doing those tests will tailor the type of treatment that we will give to that patient. Take, for instance, there is a particular type of breast cancer called the HER2 type. Now, the HER2 type means that there is an expression of a receptor called HER2. It stands for human epidermal receptor 2. Now, what that does is that it has a particular peculiarity. It's a very aggressive form of cancer. It spreads quickly to the lungs, to the brain, and to the bones. So it's aggressive. But the good news is that I call it the good type, because there are receptors, there are drugs that target those receptors. So if you are able to use those drugs, you will be able to cure even those metastatic sites, like whether it's in the lung or in the brain and so on, depending on how quickly you are able to detect it. So, and there are others that you don't even need drugs like chemotherapy. If you have a disease that is called luminal A, where you have an expression of the estrogen receptor and progesterone receptor, you may not require some form of chemotherapy, depending on how active the disease is dividing. And we can actually test that. There is a test called Ki67 that will show you how quickly the disease is dividing. So yes, there are a lot of progress that have been done across the world. Now the question is, do we have them here?
Okay, so let me just hold you. We're making progress according to you. I want to also bring Her Excellency Mrs. Betty Anyanwu Akeredolu. And by the way, Chioma has an incredible story that she will be telling us much later on. But Your Excellency, you've also been in this campaign, awareness campaign, for breast and cervical cancer for quite a long time. Do you agree with Dr. Bello that the numbers are coming down?
Well, the only way we can measure or ascertain that the numbers are coming down is when you look at the stage of presentation at the hospitals. I hope I was able to follow his line of conversation, because my system got frozen here. But if he's talking about death rate, I will rather talk about what we see on daily basis. We still have women coming with late stages of the disease, 3 and 4 stages. For a very long time, there hasn't been any change. And year in, year out, am I communicating my...
No, you are. Hello? You are, Your Excellency.
Are you with me?
Yes, absolutely. Absolutely, we are.
It's when you see the graph come down, then you say, yes, the numbers are coming down. But as we speak, even 2 days ago, it was the same story at the International Cancer Week. Women still present late, 70%, some say 80%. So there must be something we are missing. Much as I would commend the efforts of the medical community, they are doing their best. But I would quickly point out that we don't have strategy to reduce breast cancer death in this country. We lack the strategy. It appears to me, and I'm talking with experience, I've been in this field in almost 25 years, and I know what I'm talking about. We seem to have started building our house without foundation. And that's why every year, doctors from hospitals still report that our women come to hospital late. Why don't we sit down and look at where we got it wrong? And I can tell you that I do. We've left awareness creation, we've left screening, and kept emphasizing on treatment. Treatment. Let's get back to the drawing board. Invest in awareness creation. Invest in screening. Let us make use of our primary health centers, the very lowest level of health care. I can tell you the graph or the line will come down. It will plateau and come down. For now, I don't see it.
All right. Thank you, Your Excellency. We'll return to you. I mean, you've touched on a very important point, which, of course, we're going to interrogate in the course of this conversation. How much awareness is being generated? What is the impact of the awareness campaign? Because we hear a lot of noise out there, but how much of it is sticking and how much of it is percolating? Back to the studios, Chioma Ikejane. Story is good. Stage 4 breast cancer. That is presenting late. And as the experts will say, that was pretty close. But yours is a success story. Tell us about it.
You know, it's interesting. As I was listening to Dr. Bello and you were talking about HER2 positive, that was my diagnosis. And so listening to you now that I've spent so much time learning about cancer is easy. But believe you me, for the average Nigerian that's listening to this, it was I didn't even understand what my doctor was telling me. And I should not have presented late because I felt a lump. I didn't pay attention because it's a silent killer. It did not harm me. It wasn't painful. And I was just really busy working, and not really paying attention to that sign. And so one day I just said, you know what, let me just go and get a self-examination. And I remember going to the hospital and they said to me, we see a lump. And I said, yeah, the lump has been there. They said, we've got to do a biopsy. And I didn't even think it was anything, right? So they did a biopsy, and here is the normal thing that happens here. It was benign. Luckily, my doctor, who had a lot of experience, he said no. He said, Chioma, is your armpits hurting you? And I said, yeah. But I thought, oh my God, maybe it's menopause. I didn't pay attention to the signs. And he said, your lymph nodes are probably infected. So he said, I'm going to run another biopsy. And I remember when we ran the biopsy and the test came back, and it was cancerous. And I was in shock. I was in shock. I mean, my life changed. What I did that saved my life, because we didn't even understand what stage I was at, I immediately said to the doctor, I want you to get rid of the lump. I didn't wait. I didn't want to go and discuss it with anybody. I knew I had to get it out. And the doctor said to me, it looks pretty big.
Sorry, I got carried away. Where did you do the first diagnosis? Where were you first diagnosed?
Here in Nigeria.
In Nigeria.
In Nigeria.
And it was right spot on.
Spot on. They gave me, and Dr. Bello is very right, the receptors. So you have to know what kind of cancer you have, and you must listen to the doctor. So when they took the lump out, it was massive. And I remember the doctor said to me, oh, Chaba, you may have to do radiation, you may have to do chemotherapy. And I didn't know anything about chemotherapy. So I did chemo, and I lost my hair. And I remember people telling me, oh, you may get, your skin may get dark, your skin. I had so many people told me so many things. And the doctor said to me, look, you are stage 4. We don't even think this cocktail is going to work.
But I want to ask you, Chioma, because the common challenge here is late presentation and, yes. Why did it take a woman of your level? So I what was that reason that you didn't go to check it out?
Because I've thought about this. I was busy working. I'm a type A personality. I didn't have any really symptoms that kept me from working out or kept me from working. I mean, that's why it's called the silent killer. I didn't even think that I would ever get cancer, because according to my physical look, I was healthy. I didn't know what was happening inside my body, even when I felt the lump. And that's the danger. There's so many women that I've met in Nigeria.
For how long did you play?
Oh, I'll give you an example. Yes. In 2014, I did a mammogram, and I was clear. There was nothing. In 2015, I started to feel the lump. I remember I would go to bed and I would turn and I would say, oh, what is that? And I just kept quiet, knowing that it could be cancer, because I've never, Dr. Bello.
That's right. You were trying to deny.
I was trying to deny, because to even admit that you are a cancer patient is stigmatizing. It's
yeah, Chioma, thanks. I mean, we'll return to you. Let's bring in Ronsi Chidebe, Chief Executive, Executive Director of Project Pink Blue. Ronsi, listening to the 3 guests who have spoken already, and taking this point out of it, because I don't know how many topics we've handled on breast cancer and awareness and cervical cancer and all the issues. Before this conversation started, Dr. Bello warned that he didn't want to hear certain kinds of questions. We had already agreed on that some years earlier, that we won't raise those questions. There are things that, of course, we'll be dealing with. But there's an issue here. Why is the awareness campaign not working? Apparently, because Her Excellency spoke to that, is the messaging faulty, or is the medium faulty, or people are just talking in the air? Typical of us, just say, this International Breast Cancer Week has come, let's do something, after that everybody goes to sleep.
Yeah, thank you very, very much. I think that's a very, very important question. But I have to be very honest with you. The major challenge is that we still see healthcare as charity instead of seeing healthcare as business. So until we continue to see healthcare as business, both policymakers, both CEOs of different corporate organizations, and everyone will take care of themselves the same way we take care of our cars. So this is the foundation of the problem. The second foundation of the problem is what I call the health system fixing. Our health system, it's not fixed in a way that prevention becomes a core priority. For instance, as I speak to you today, once anyone comes to any public health facility, the doctors and nurses will encourage you to do HIV tests. It helped us several years, and we're able to catch HIV very early. And then we also make all the noise like what we're doing now to get funding and to get people to provide support for HIV. We need to replicate that strategy because it worked in Nigeria. Why is it that a man that is 40 years old or a woman who is about 30 years old will walk into a primary health care center to do antenatal and all the rest, and nobody will tell her about cancer? This is the foundation. This is the health system issue we need to fix. By that way, we can catch cancer early. I mean, Dr. Bello mentioned something, and also Claire mentioned something about how can we get this chart go down. To be honest with you, the chart may not go down till several years now. And I'm not shocking you, I'm just being very honest. The reason is because more Nigerians are beginning to be more European than the Europeans. So that becomes a very critical problem because we are deviating from the nutritions that we're used to all sort of canned food and all sort of things that put us at greater risk. So our focus should not be on trying to force the curve down, because the curve can't go down, because cancer takes 8 years to come up. What our focus should be is to plan strategy. Well, we already have a plan. We already have a strategy. It's just to get that strategy to work so that people can be captured early. These cancer patients, men, women, children, are Nigerians. They are our people. But the problem is we are not working, very hard to ensure that cancer becomes a priority and healthcare in general becomes a priority.
Okay, Kingsley, we have Emmanuel Okorie, who is also with us, of course, in this conversation. Emmanuel, you've listened to, other speakers here talk about the gaps. What's your own impression? Why are we having awareness, for cancer, breast and cervical cancer? Why are we having low awareness about those ailments?
All right, thank you. And I really agree with my colleagues that have spoken earlier on, especially Ronsi and Her Excellency. I think the critical thing is we need to strengthen the system and also support it. If we strengthen the system and we do not create support system, then it's not going to work. First and foremost, we have tertiary institutions. We have kids that attend these schools. Why can't we make it a requirement every time they come back to school for them to go and run the test? All these universities have teaching hospitals. I know there is a situation with financing, but this is where the government needs to come in. And we can also look at the public sector, people that work in the public sector. Why can't we have them run a test once every year or twice every year? I have no doubt that we can do this thing successfully. It's just to strengthen our system and provide innovative financing. NHIS is there. They have a lot and they have capacity to do a lot. And thirdly, I think we need to also strengthen the infrastructures, the equipment. We also need to be able to do patient tracking. What we are doing today, it's something close to it, and we have also onboarded patient tracking. So for kids that are in school, you'll be able to track them from the first year in college all through their graduation. And when they get into working, the organized private sector should also have this thing. And I agree with Ronsi. HIV is front burner. We can also do the same for cancer. We don't have to slow down the effort. We just need to create innovative finance to support this whole system. Thank you.
Mr. Okorie, I need you to please take me out of the dark. I'm wondering what EMG, stands for, what you actually do. I get the feeling that you provide some sort of support to government to, address the issue of cancer management and treatment. Is that what you do?
Yet, okay, MG Resources is focused to provide last mile logistic to the patients and to the pharmaceutical companies. Currently, we are approved to manage Cancer Access Partnership Program, which is a program that was set up by Clinton Health Access Initiative and American Cancer Society with the federal government. So what we do is to bridge in the gap, because prior to today, there were stockouts of cancer drugs. As a matter of fact, we onboarded another facility yesterday. And the first question I asked them, do you have oncology drugs in your pharmacy? And the answer was no. And I was shocked. How is this possible that they do not have oncology drugs in their pharmacy? So when you have cancer patients come to that facility, what's going to happen? So what we do is to provide inventory management and sales management and accounting and patient tracking for this program. So we are also managing the Cancer Health Fund, which is new. The federal government set up a fund, about ₦1 billion, to provide cancer care to indigent cancer patients. And I can tell you today that we have over 300 that have registered for that program. And we are talking about awareness. I can run you through the data of people that have registered in each region. For North Central, we have about 218 that have registered. For Northeast, we have only 22. For Northwest, we have only 34. Southeast, only 10. South-South, only 27, and Southwest, only 22. And I am aware there are a lot of indigent cancer patients that cannot afford cancer care. What are we going to do? How do we bring this thing to their knowledge? I know the NGOs are doing a whole lot, but we need to step up. We need to strengthen the system. We need to find a way to make people to know this. This is what MG Resources is doing. And for all these people that have registered to be approved for the Cancer Health Fund, we are already tracking them. So this is, we provide support for the whole system in the cancer space. Thank you.
All right. Thank you very much, Emmanuel Okore. We'll come back to you later on in the course of the conversation. Now back to Dr. Mohammed Bello. Dr. Bello, you were telling us about what is working elsewhere around the world, and then you were getting to the Nigerian space to tell us what is working or what isn't working and why, and probably what can be done.
So thank you very much for taking me back, Kingsley. You know, Her Excellency was talking about the numbers, and I didn't say that the numbers were actually coming down in Nigeria, and there are so many reasons. You know, she talked about screening and awareness, which is fundamental, yes. But when you look at awareness and screening without treatment, you're like giving tea without tea. I mean, a lot of people are aware, and then you do screening, and then they are detected that they have cancer. Then what? You need to treat them, right? And if you don't have treatment facilities, then you are in trouble. So that is why they must go together, you know. So in Nigeria, yes, Emmanuel had just mentioned of the Cancer Health Fund, which the federal government was kind enough to appropriate up to 1 billion naira in the last 2 years. And they have already started, you know, implementing it. And we were told that in this year's budget, there is also about 600 million for the Cancer Health Fund. And we hope it will be put to use. Now, treatment of cancer is expensive. And until this point, you know, it is out of pocket in Nigeria. And that must not continue, because you can't afford, I can't afford cancer care. That is the truth. If Chioma here will mention how much money she has spent, it is almost impossible to imagine it, that one individual is able to cough out that kind of money. So it is expensive, and we also have falsity of facilities and even care providers. What works? Well, we have some centers that are springing up, and yet we have not been able to provide capacity. There's a lot of brain drain. A lot of the professionals are no longer here. The last people we have trained at the National Hospital, I think only one actually remained in Nigeria. All the others.
How many did you train? 3 or 2?
No, we have trained about 6 in the last couple. I mentioned it, yes. So only one, which is that is in Jos. The others have all fled. And training a cancer specialist take a lot of effort, many years, and so much resources is usually put into. But there is no real incentive to keep them here. If I give you an example of what the World Health Organization is putting in place for cervical cancer, the strategy to eliminate cervical cancer by 2030 is called 90-70-90. What does that mean? It means that we will need to vaccinate about 90% of the population, girls and boys. By 2030, 90% should have been vaccinated, and 70% of women would have been screened for cervical cancer, and 90% of those that we found with precancerous and cancerous condition should have been treated by 2030. So treatment is an integral part of elimination of any cancer. So yes, you can create awareness, you can do a lot of screening, but you must provide facilities that will treat patients. Otherwise, you are going to create a chaos, because you finish your screening, you've detected patients, then they have nowhere to go for treatment. And it's so important to recognize also that, take for instance, treatment of cancer is so, we have patients that present late, so they will require radiation therapy at one point or the other in their cancer treatment journey. And Nigeria requires, by World Health Organization standard, 200 radiation therapy machines. How many do we have now? Less than 10. What are we doing to get more? It's bleak.
Okay, thank you. Back to Akure, where Her Excellency is joining us from. Your Excellency, you've listened to Dr. Bello. I mean, treatment, it's an important, aspect, of course, of managing cancer, either breast or cervical cancer. But we are told that early detection is key. It's probably what works most, and that's where your outfit, is concentrating. But without mainstreaming testing and screening into a primary healthcare immunization program, how are you able to, get the number of people, to come forward for testing? You just heard Mr. Kore reel out the very poor statistics of, the awareness statistics from different parts of the country. How are you able, what strategy are you using for testing, for getting people to come to test?
Thank you. Thank you very much. I want to correct the statement I made when the doctor talked about the chart or the graph. Like I said, I lost the signal. My system was frozen, so I didn't really get him quite all right. We're on the same page that the numbers are not coming down. Then to the issue of awareness that you asked about the strategy, I like the word strategy. And that's exactly what we lack in this country. I am very much aware that you need the entire continuum of cancer control to even think of having a good outcome, starting from prevention, education, screening, treatment, and aftercare. All must go hand in hand. And that's where the problem lies. We don't have that strategy. Would you believe me that the burden of raising awareness and even screening of cancer lies on the shoulders of yours. In this country, Ronsi is there, he will bear me witness. You don't have population structured screening. Neither do we have for education. You just have NGOs running here and there. They do the little they can. Government is not even supporting NGOs. Many ministries, nearly all the Ministry of Health in this country, they don't have budget line for cancer control. It was only when I got here, because of my experience, I'm on the lookout of what states are doing in cancer control. In Ondo State, as far as I can tell, 2017, 0. They neither observed those months for celebrating or marking cancer to raise awareness, World Cancer Day, Breast Cancer Awareness, nothing, 0, not to talk of money. We had to lobby for the assembly to even approve a budget line. Check all the ministries of health in this country. I don't know how many of them have a penny for cancer control. So that's where you start. Even when you make all the noise and government has not seen cancer as a health issue, you'll be wasting your time. And I keep saying, we don't have the foundation to control cancer. Probably after today, they will look at it. We need to sit down and have a strategy. Again, we will start at the primary health care level. That's where the education will start. That's where the screening will start. That's where we tell all these churches, Bogbonshe churches, to say, stay away. There must be a deliberate action to really go ahead for cancer control in this country.
Okay. All right. Thank you. Thank you, Your Excellency. But let's come back to the studios. Ronsi Chidebe, earlier in your intervention, you did say that there was, probably there still is, a strategy document for either creating awareness or cancer control in the country. And that appears to be, of course, different from what Her Excellency is pitching at the moment. Do we actually have a strategy paper? And if so, what are the contents? And how far has it taken us in trying to control cancer by awareness or other means?
Okay, thank you very much. I mean, I totally agree with Her Excellency, but I don't know if, I don't know a clear definition of what Her Excellency means by strategy, if it is the same thing as what I can call strategy, I mean, in terms of what is available right now. So what the Nigerian government actually have now is called the National Cancer Control Plan, 2018 to 2022. This plan is one of the best plans in the world, and I repeat, is one of the best plan in the world on cancer control. This plan has been reviewed. I personally reviewed this plan while I was in Maryland at the National Cancer Institute Fellowship, and I reviewed many other plans across the world, and I realized that this plan is actually a plan that should be used to really, mitigate cancer and control cancer.
So
but this is the problem.
Why is it not working?
This is the problem. I'm going to read that out to you. This is the problem. The problem is that this plan was costed, and this plan was planned, was prepared properly. The ministerial committee, which I am part of, and I mean, many of my colleagues are part of, we all are in the ministerial committee. But the problem is that this plan is not funded. And any plan that is not funded is just as useless as it's not a plan.
That's exactly what Her Excellency meant by you don't have a strategy. If you have a paper strategy, you don't have the funding for it. You don't have a strategy.
Good. So I will tell you some of the foundational issues that you will need to do to make your plan work. I mean, I've done research in the UK, US, and many parts of the world. One of the main strategies that you need to make any plan to work, apart from funding it, is that you should have a structure, a system. How can Nigerian government have just less than 10 people managing a disease that is killing over 100,000 people. What we have at the moment is the National Cancer Control Program. That is a desk that has less than 10 staff. They don't even have a budget. The budget they have every year is less than 500 or 600 million, or probably less than 1 billion. What we are really doing now is that we're just doing palliative to cancer. I'll share something with you. In 2016, Senator Honorable Mohamed Usman and Senator Mao Huabunwa pushed for a bill. The bill is known as the National Institute for Cancer Research and Treatment. That institute was meant to be the same way we have the National Agency for the Control of AIDS, so that you have a proper institute and a proper person you can hold accountable in controlling cancer. The same way you are holding Chikwe, Dr. Chikwe, former for COVID-19 and other Lassa fever and all the rest. So we don't have anyone you can hold accountable in cancer. As we are talking, all of us are talking to the minister. The minister has multiple diseases. This bill that was passed in 20...
To deal with.
Yes, to deal with. Sorry, to deal with. I beg your pardon. Yeah. So the issue now is that the bill, this National Institute bill for Cancer Research and Treatment, was passed and was signed by the President Muhammadu Buhari in December 2017. 2017, 2018, 2019, 2020, 2022, 5 years, nothing has been done. This bill has not been gazetted, it has not been budgeted for. So who is going to control the plan? Who is going to manage the plan? Another very important thing again is decentralizing cancer control. We need state government to start taking action. The governors are not doing enough. I can mention a few governors that are working right now, like the governor of Kebbi. We know a lot of prostate cancer patients are receiving free treatment. Ondo is also doing something. Oyo is doing something. Linda Ayede of Dr. Linda Ayede of Cross River. We need every state to take cancer control as a primary health issue. We can't continue, playing by the gallery and think something will change. Nothing can change. That's the reality.
Ronsi, thank you very much for the additional perspective you have provided with regard to the plan, the cancer control plan in the country. But it is obvious that if the funding component wasn't addressed, then that plan was probably designed to fail. It's not in all cases that you'll be looking for donor funds to enable you execute a plan for your own domestic population. When your people are healthy, your country is also worthy. But thanks a lot. We'll still come back to other aspects. Perhaps you keep thinking about how we can activate critical aspects of that plan going forward. But back to Chioma Ikejani. Chioma, Dr. Bello was drawing attention to the enormous cost in managing cancer, treating cancer. You may wish to disclose the figures, but when we say treat cancer, it's the impression is given. I mean, somebody will probably have the impression that it's like a headache or malaria. You just go, they'll give you this, the usual injection, ACT, and you go. But tell us, what is the regime of treatment, and what does it do to your whole schedule and mental health even?
Cancer, it interrupts your life. It really does. First of all, if you get cancer and you're going to the treatment, you really have to stop working. So I stopped working for 1.5 years to get my treatments.
Why?
Because you have to do chemo, and you have to do it I think I was doing it every week, and I did 9 cycles. So when you do chemo, it really interrupts your body, there are side effects, and I took cancer as a project. I think there's some people that wanted to work, but because of my stage, and I wanted to live, and I took it as a project. So I took 1.5 years off. I went to Canada because I was diagnosed here, and there wasn't any, at that time, 2015, end of 2015, I was advised to go back to Canada because I'm a Canadian citizen. It really wouldn't cost me anything. And I remember after I finished my chemotherapy, and I told my doctors that I want to come back to Nigeria. And they thought I was crazy. They said, what? We have invested so much in you. What do you mean you want to come back to Nigeria? So we also have to care about what the international community thinks about Nigeria and the health sector, because they advised me not to go. And I had to sit in front of the board of my hospital and give them reasons why I wanted to come back to Nigeria. So I said, part of your responsibility is to let me live a normal life. And part of my normal life is living in Nigeria. So they agreed, and as long as I did all the things that I had to do, it meant that coming back to Nigeria, I would have to do a CT scan, I have to do an MRI, and every 21 days, because I take Herceptin and Projecta, I would have to pay out of pocket. Instead of staying in Canada and getting it free, I would have to pay for my drugs. Now, I'm going to go on the good news. The costing of drugs for cancer has actually come down quite substantially. And I really want to thank Emmanuel that spoke, because he is the backward integration powerhouse that makes people like me access my drugs. So I'm at National Hospital. I have registered with his company, and I'm able to get the drugs 50%. When the government did that, I thought, oh my God, this is incredible. But it's still a little bit costly. So every 21 days, as long as I stay in Nigeria, I have to pay for those drugs. On top of every 3 to 6 months, I have to do a CT scan. I have to do an MRI. In fact, a couple of months ago, Dr. Bello, you don't know this, I had pain at my back, and I thought, oh my God, I have bone cancer, it's come back. And I remember I called National Hospital, and you know what? I was able to go and get a scan. I can't remember what they call it now, and there was nothing. It was, I'm fine. I'm what you call no evidence of disease. So luckily, and I've changed my whole life, I've changed my whole eating habit. I don't eat meat. I'm a complete vegetarian. So absolutely, it interrupts your life. But I do love cancer. And I know people that are listening to this, you know what? It changes your life. When I look at Her Excellency, and every time I hear her speak, she comes from a place that is inside. It changes you. It turns you upside down. So when people look at me and I say to them, oh, I'm stage 4, I'm cancer, and they go,
stage 4?
Yeah. And when I tell people I'm stage 4, they don't know how to look at, I was stage 4. They don't know how to look at me because I don't look like anything. I don't even look as if I have cancer. So Nigeria is doing a lot. It used to take me 7 to 8 hours in 2016 to get my drugs when I went to National Hospital. Do you know on Thursday, it took me 5 minutes to get my drugs. That is the progress that we've made.
Sorry, do you think it's because access is easy, seamless, or do you think it's because maybe of your personality, of who you are, that you are able to have, it easy? Because there are a lot of people who are down with cancer, who are appealing on the TV and all that, and they can't access help.
I'm going to address the audience. It's a will to live. We have to own cancer, because 1 in 3 women will get cancer. Those are the statistics. So I think it's a will. I wanted to live. And I'm not sure whether it's my personality. I was dogged and I fought to live. And I had to do a lot of radical changes. I had to change the way I look at cancer. I couldn't fight cancer. I had to embrace and own cancer. And I had to see that I have another body inside that I have to look after. So I think it's a mindset. If you ask Her Excellency, what was it about her that has given her 24 years? It is her will to survive. And I think that the Almighty God made it possible for me to be alive to talk about this. I think there's a service to society and to talk about cancer. So I think that's what it is.
Yeah, but Dr. Bello, you are itching to say something before we get back to Emmanuel?
She asked a very important question. Claire asked that question about the where she's able to actually access the treatment quickly. I think she had to pay, and that is fundamental. If she doesn't have the money, she will not get it in 5 minutes or in 10 minutes. It's still expensive. 79% of Nigerians live below the poverty line. That's the fact. Less than $1 a day. That's the statistic that we know. I don't know if it has changed. And do you think people like that will be able to afford Herceptin and Perjeta? It's not likely. So definitely the National Health Insurance must come in to support every Nigerian, not only those that are actually registered, because we have just about 1.5% of the population that are on the NHIS. And even at that, some things are covered in the NHIS for cancer care, but it's not much. And it is a far cry from what we expect. That's one thing that I wanted to mention. The other thing that we have not talked about is the prevention, the vaccine. We've been told.
We're going to come to
that,
yes,
because
we're going to come to that.
it's very
I
critical.
just wondered, Emmanuel Okori, tell us something, because sometime in the past, the story was that cancer drugs, if I use that in a generic sense, were either scarce in our pharmacies, or where they were available, they were pretty expensive. What has been the change factor in the availability and affordability of cancer treatment drugs?
Thank you. Thank you. I think the federal government, in collaboration with Clinton Health Access Initiative and American Cancer Society, has done a great job in this space. What they did was to come together with multinational pharmaceutical companies to agree to have cancer drugs sold to patients at minimum 50% rebate. This is why a whole lot of people can get the cancer drugs at 50% rebate. There are some cancer drugs that are sold for 1.2 million naira. And cancer patients take this in 3-week cycle. There are some for 800,000. There are some for 600,000. So with the CAP program, that's the Cancer Access Partnership Program, you have 50% rebate. I think the state government should sign up to this program, because it's going to help them. It's going to help the cancer patient, to be able to access drugs, not just at cheap rate, access it timely, and, they wouldn't have stockouts of these drugs. Again, like where we went yesterday to onboard them for this program, there was no single oncology drugs in the pharmacy. So if it's like that at a federal institution, I don't know what it's going to be like at state facilities. So I am encouraging the commissioners of health at every state in Nigeria to write to the Honorable Minister of Health indicating their interest to participate in the CAP program. That way, the access program will get to the patient that needs it most. So that's number one thing that we need to do. I know my brother Ronsi talked about strategy, and Her Excellency talked about strategy. Yes, we can have all the strategy, and I agree with him. Without funding, these strategies are not going to be achieved. And yes, these strategies are not funded, so implementation is poor, but we should be able to still carry out M&E for learning. We should be able to say, oh, this was in the program, but there was no funding. We should not keep quiet. We should not let that strategic plan just go down the drain. We should bring it up, and we should find a way to get government engaged. To be honest, the federal government is doing a great job, just that they can do much more. the things we should be addressing it, what are the possible areas that funding can come? We know that funding can come through multilateral, from multilateral donors. Government is required to be able to match certain donor requirements. For example, government can even initiate and make these telephone companies, for every data that people reload, they can contribute 50 kobo to a cancer fund or 1 naira to cancer fund. This can go a long way. I know a couple of years back, the pension fund was made to put money in real estate because there were shortages of houses. Right now, we have houses that nobody is living in there. There are houses all over the country. They are not even affordable. So why can't we repeat those kind of ways of funding a national problem? And Ronsi said earlier that until we see cancer care as business, it's still going to be the way it is currently. So we need to find a way of bringing the business concept to it. Get pension fund into this into these areas. It's not just cancer. We have other disease areas too. So it's just to structure this funding and make sure that it's transparent, it's monitored, and there are audit trails for whatever is spent. Thank you.
All right, Mr. Okore, thank you very much. When we come back, I would have loved you to tell us how many drugs, that the 1,800,000 naira you talked about, how many drugs will that cover? But when we come back, you give us that information. This is Good Morning Nigeria. I'm sure you're having an interesting discussion here. We'll be right back just in a moment.
All right, you're welcome back, and it's still Good Morning Nigeria. We're live on the network service of the Nigerian Television Authority. Before we went on the short break, my colleague Claire kept a question in abeyance for Emmanuel Okore. Emmanuel, you were telling us about the availability of the drugs and relative affordability. But tell us, 1.something million for how many doses and how often? So is it still a big man's medicine, or the poor can come somewhere near it?
Thank you so much. I can't speak to the cost of the drugs because there are different types of drugs. I'm not a medical doctor. I'm just an accountant. So it's difficult to say for this drug and that drug and that drug how much it's going to cost. But rather, I can say that currently we have over 300 indigent cancer patients that have registered and applied for funding on the Cancer Health Fund program. Looking at what we have in that fund, which is 1 billion naira, it means that on the average, let's assume that the CHF Secretariat will approve this fund equally. It means that each indigent cancer patient may not get more than 3.3 million.
All right, Emmanuel Okore, thanks a lot. Let's, happily we have Dr. Mohammed Bello here with us in the studios. He prescribes, and he also, I believe, has an idea of the cost of these medicines. Just break it down for us. Can the poor access it, or is still perhaps the affluent that can't take these drugs?
So the answer is categorically no. The poor can still not afford cancer care because it's not only about the drugs. There are other things like surgery, there is radiation therapy, and so on. A session of radiation therapy at the National Hospital costs 600,000 naira for a treatment after breast surgery. And the surgery in itself, it's a couple of thousands of naira. So if you are coming from a background of less than $1 a day, that's what you have, that's what you earn, how can you possibly cover those kind of money? So people still die because they cannot access treatment. And when we talk of the kind of treatment that Chioma is receiving, that is the 1-point-something million that she's talking of.
No, but it has,
Yeah.
has in the beginning, it was.
Let me finish. Chioma, let me finish, because I'm still there, right? So even if you are paying 50%, you are talking of over 600,000. And you must pass through certain rigorous checks and balances to know that you are an indigent person. How do you determine who is indigent? As far as I'm concerned, every cancer patient is indigent. No matter how rich you are, if you are stage 4, you are in big trouble.
And I have to take it
You are in big trouble. And she is taking this treatment for life, not only her, and so many other people.
Program.
So the truth of the matter is that, yes, this is something that is right to start with, but it is not yet eureka. It is not yet the end of the road. We have to find innovative funding to support cancer patients. Otherwise, all that we are doing, and there are only few drugs that this CAP program has actually started. Other people are coming in. It will take forever because simply the money is not there.
Okay, Dr. Bello, thank you. Let's take Her Excellency, Mrs. Betsy Ayanwa Keredolu, who's joining us via Zoom from Akure. Your Excellency, Runsi talked about the path, state governments are not playing even in the whole of cancer treatment, management, and prevention and all that. Why is it that state governments are not making cancer a priority in their health, care programs and policies?
Thank you so very much for that question. If you may give me just a minute to explain the difference between plan and strategy. When Ronsi said he didn't understand what Her Excellency was talking about, whether it's the same thing as the plan. When you have a plan, it serves as a guideline. At the federal level, they have given us plan that had gathered dust for so many years. It was left for the state governments to now adopt that plan, come home, domesticate it, and now strategize how to implement it. Difference. That had not been done. You need advocacy. This is where NGOs, the medical community, the cancer experts will come in and drive the process. By the time they keep shouting and shouting, the governors will begin to listen and probably declare a state of emergency like they did for sexual gender-based violence. I hope you are aware that sexual gender-based violence, the governors declared a state of emergency, and all of us, majority of First Lady ensured that the VAP law passed as far back as 2015 at the federal level was domesticated in our respective states, and we've all begun to strategize on implementation and give it teeth so that we can bite on those who would try to defile our daughters or sexually molest our women. That is the process, plan, strategy, and so on. So we need to move. Nigeria Cancer Society, you need to move. We'll make sure that the governors listen. The governors also declare cancer as a state of emergency. My heart sank when the accountant was talking about saying, after all, cancer is not the only disease. You cannot tell that to my family. And so many families in this country that gone into bankruptcy, lost their loved ones, and you're telling me cancer, after all, is not the only disease. My heart sank, and I'm very unhappy about that statement. Cancer, we must endeavor to make sure that it becomes a health priority. Is such a disease that not many Nigerians can afford it, and majority of people who experience this disease are poor. Are we not going to fold our arms and watch them? I have given you a way out, a window of opportunity for us to tackle these things. Let us go down to the basics. Let us make sure that our people even understand this word cancer. You cannot treat what you don't know. They must understand. The system must enable us to screen and make sure that those who have the disease, they are presenting at early stage, because when you present cancer at early stage, the likelihood of survival is enhanced because of the lack of awareness, because of this lack of population screening is making our people come to hospital at a terrible stage when very little help can be rendered. I have stated my own. Let us work towards declaring cancer as a state of emergency. I want to believe that the governors will listen. When they listen, during their budget or during their budgeting, they will put money under cancer control. Thank you.
All right, thank you very much, Your Excellency. I want to know whether Emmanuel will have the opportunity in the course of the conversation to respond to the point you made. But I think that, let me just be his advocate. The sense in which he said that cancer isn't the only ailment is not to diminish the importance of the attention that should be focused on cancer. It's just that, of course, you have a cocktail of ailments that people are dealing with. But back to Dr. Mohammed Bello. Dr. Bello, we've been focusing on breast and cervical cancer. Let us assume that by some miracle, breast and cervical cancers are eliminated. Are there other forms of cancer that we are neglecting that could then be a challenge for us going forward?
Yes, but yes and no. If you look at the statistics of female cancers, if you are able to treat and reduce the incidence of breast cancer and eliminate cervical cancer, and mark my words, you would have reduced the female cancers by over 50%.
What about the use of vaccines? Because we
so,
wanted to, yes.
So that's why I said if you are able to eliminate cervical cancer. So in other words, it's possible to really eliminate cervical cancer because we know the causative agent, the human papilloma virus. Now, you can't do that for breast cancer because there are so many risk factors. And as long as you are a woman, you have the risk of developing breast cancer at one time. So cervical cancer, the World Health Organization has actually put in strategies to eliminate it by 2030. Now, I am not sure that we are putting things in place in Nigeria to be able to eliminate cervical cancer by 2030. I have mentioned it, the 90, 70, 90%. Those are the strategies like Her Excellency is talking about. The 90% of girls and boys that will be vaccinated, we haven't seen the vaccine yet. We were told by the National Primary Healthcare Development Agency that they will institutionalize the human papilloma virus vaccine this year. We are in the end of November, and we are still watching, and we are hopeful that it will be institutionalized as a national immunization program.
Okay.
And we must do the 70% screening and treat those that already have cancer. Otherwise, Nigeria will be lagging behind. 200 million people will be lagging behind the World Health Organization strategy. Something has to start now.
Chioma, briefly.
For anyone that's watching this, and I'm going to speak as a survivor.
Briefly, yes.
Cancer is not a death sentence. You can survive cancer. Thank you.
All right.
Ransi, Your last comment. Just
Okay,
30 seconds.
thank you very much. I just wanted to say that innovative financing is not really the core problem in Nigeria. I think the core problem is the government's will to really take up this innovative financing and other things forward. Thank you very much. If we can take up these things, a lot of changes will happen. Thank you.
Ronsi Chidebe, Executive Director, Project Pink Blue, and the latest newlywed. Your spouse should be lucky. At least, you'll be there for her to do all the checks of breast cancer. I want to appreciate you. Thank you very much. Chioma, good news. Chioma Ikejani, stage 4 breast cancer survivor, and host and producer Amoy Unplugged. I'm glad for you. Thank you for joining us and sharing your experience.
It's been a pleasure.
And also Emmanuel Okorie, Chief Executive Officer, Image Resources, MG Resources Limited. Thank you very much. Thank you. Also, Her Excellency Chief Mrs. Betty Anyanwu Akeredolu, founder, Breast Cancer Association of Nigeria, 24-year-old breast cancer survivor and wife of Ondo State Governor, who joined us via Zoom from Akure, the capital city of Ondo State. I almost forgot. Dr. Mohammed Bello, President. I'm sorry, Dr. Bello. You are our friend. Thank you very much for joining us. Let's check out sports now.
Barcelona have appointed Sergi Barjuan as their interim